What if the way you sleep tonight could quietly affect your stroke risk tomorrow morning? Most people spend nearly a third of their lives sleeping, yet very few realize that sleeping position can influence blood flow, breathing, and even pressure inside the brain. And according to several cardiovascular specialists, one particular sleeping position may increase the risk of circulation problems during the night, especially in adults over 60. As a cardiac surgeon who has spent years studying the relationship between circulation, heart health, and aging, I can tell you something surprising. Small changes in how you sleep can sometimes have a measurable impact on your long-term health. Tonight, I'm going to explain which sleeping position doctors warn about, why it may affect stroke risk in older adults, and the safer alternatives many specialists recommend. But first, I'm curious, how do you usually sleep? On your back, on your side, or on your stomach? Let me know your age and your favorite sleeping position in the comments below. I always enjoy seeing where everyone is watching from. Now let's talk about what happens inside your body while you sleep. Why sleep position matters more after 60. Many people assume that sleep is simply a time when the body shuts down and rests. But medically speaking, sleep is actually a period of extremely active internal regulation. During sleep, your body is constantly adjusting. Blood pressure, heart rate, oxygen levels, brain circulation. For younger people, the body typically adapts very easily to these changes. But after the age of 60, certain systems become less flexible. Blood vessels stiffen, circulation slows slightly, and the body becomes more sensitive to pressure changes. That's why cardiologists and neurologists increasingly pay attention to sleep habits when evaluating long-term health risks. And surprisingly, sleeping posture plays a larger role than most people realize. The sleeping position doctors warn about. Let's talk about the position that many cardiovascular specialists advise older adults to be cautious with. Sleeping flat on your back without support for the head and neck. Now let me be clear, for many people this position is perfectly safe. But for some older adults, especially those with circulation issues, sleep apnea, or high blood pressure, sleeping flat on the back can create several physiological challenges during the night. The first issue involves airway restriction. When lying flat on the back, the tongue and soft tissues of the throat can fall backwards slightly. This narrows the airway. For people with even mild sleep apnea, this can reduce oxygen flow during sleep. And lower oxygen levels place extra strain on the heart and brain. Over many years, this repeated strain may contribute to cardiovascular problems. The oxygen connection. Your brain consumes roughly 20% of your body's oxygen, even though it only represents about 2% of total body weight. Because of this, brain tissue is extremely sensitive to drops in oxygen levels. During episodes of disrupted breathing, even brief ones, oxygen saturation can temporarily fall. In response, the body activates stress hormones. Heart rate rises, blood pressure increases, and blood vessels tighten. Over time, repeated episodes of nighttime oxygen fluctuation may contribute to vascular stress. This is why many neurologists emphasize the importance of stable breathing during sleep. And sleeping posture can strongly influence that. Circulation and gravity. Another factor involves something very simple: gravity. When you lie completely flat, the way blood distributes in your body changes. Fluid may accumulate slightly in the upper body. For healthy individuals, this typically isn't a problem. But for older adults with cardiovascular concerns, fluid shifts can sometimes increase pressure in certain blood vessels. Doctors studying overnight circulation have observed that body positioning can influence how efficiently blood returns to the heart. This is particularly important for people who already experience swelling in the legs, heart rhythm issues, reduced circulation. That's why sleep specialists often recommend elevating the upper body slightly rather than lying completely flat. Another concern: sleep apnea. One of the biggest reasons doctors talk about sleeping position today is the rise of sleep apnea. Sleep apnea occurs when breathing repeatedly stops and starts during sleep, and it is far more common after age 60. Many people don't even realize they have it. Symptoms may include loud snoring, waking up tired, morning headaches, daytime fatigue. Studies show that sleeping on the back can worsen apnea episodes, while sleeping on the side often reduces them, because gravity pulls the airway open instead of letting it collapse backward. For people with sleep apnea, improving sleep posture can sometimes reduce breathing disruptions significantly. The safer sleeping position. Now let's talk about the position many doctors recommend: sleeping on your side. Side sleeping tends to promote more stable breathing because the airway remains more open. It also allows the tongue and throat tissues to fall naturally to the side rather than backward. In addition, side sleeping can support healthy circulation. Some studies suggest it may improve the way the brain clears metabolic waste during sleep, a process linked to long-term brain health. While research is still ongoing, neurologists find these results very interesting. Left side versus right side. Many people ask whether sleeping on the left side or right side is better. For most healthy adults, either side is perfectly acceptable. However, some cardiologists suggest that left side sleeping may slightly support circulation for certain individuals. The reason relates to how the heart sits within the chest. When lying on the left side, gravity may assist blood returning to the heart. But the difference is generally small. The most important thing is simply sleeping on your side comfortably and consistently. Supporting your neck and spine. Your sleeping position alone is not the only factor. Proper pillow support also matters. If your head is tilted too far forward or backward, it can affect airway alignment. The ideal pillow keeps your head, neck, and spine in a relatively neutral line. For side sleepers, a slightly thicker pillow often works best. For back sleepers, a thinner pillow with gentle neck support may help maintain proper alignment. Good alignment promotes easier breathing and reduces muscle tension overnight. A small adjustment that can help. If you naturally sleep on your back, there is a simple adjustment many doctors recommend. Elevate your upper body slightly. Using a wedge pillow or adjustable bed can raise the head and chest by about 20 to 30 degrees. This gentle incline can reduce airway collapse, improve breathing, support circulation. Many people with reflux, snoring, or mild sleep apnea notice improvements with this simple change. The role of nighttime blood pressure. Another reason sleep posture matters involves nighttime blood pressure patterns. Normally, blood pressure dips slightly during sleep. Doctors call this nocturnal dipping. But for some individuals, especially older adults with hypertension, blood pressure may remain elevated overnight. Disrupted breathing or poor sleep quality can contribute to this, and elevated nighttime blood pressure has been associated with higher cardiovascular risk. Improving sleep quality, including breathing stability, may help support healthier nighttime patterns. Other habits that protect brain circulation. Sleeping position is just one piece of the puzzle. Doctors studying stroke prevention emphasize several nighttime habits that support healthy circulation. For example, avoid very heavy meals right before bed. Large meals can increase blood pressure and heart workload during sleep. Another tip is to limit alcohol late in the evening. Alcohol may initially make people feel sleepy, but it often disrupts sleep quality and breathing later in the night. Maintaining regular sleep times can also support the body's natural rhythms. When sleep cycles stay consistent, the cardiovascular system tends to function more efficiently. Why good sleep is one of the best health tools. Many people underestimate how important sleep is for overall health. But during sleep, your body performs critical maintenance tasks. The brain clears waste products. Hormones regulating blood pressure and metabolism are released, and the nervous system resets itself. Poor sleep quality has been linked to increased risk of heart disease, memory decline, metabolic disorders, and stroke. That's why small improvements in sleep habits can sometimes produce meaningful health benefits over time. Final thoughts. If you take one message from this video, let it be this. Your body continues working hard for you while you sleep. And simple adjustments, like improving sleep posture, supporting healthy breathing, and maintaining good sleep habits, may help support your heart and brain for years to come. If you're over 60, it's never too late to improve your sleep routine. Small changes practiced consistently often lead to the biggest results. Before we finish, I'd love to hear from you. What sleeping position do you use most often? Side, back, or stomach? And have you ever noticed changes in your sleep quality depending on how you sleep? Share your experience in the comments below. I read many of them and they help shape future videos. Thank you for watching, stay healthy, and I'll see you in the next video.